Comenzamos.
Let us get started.
¿Podemos dar la bienvenida?
First of all, welcome.
Muchísimas gracias.
Thank you very
Hola a
much.
todos, buenos días.
Hello,
Muchas
everyone. Good
gracias por
morning.
unirse hoy a
And
nuestro
thank you very much
webinar
for
dedicado
joining
a las
our
buenas
webinar,
prácticas para las enfermedades
Good
crónicas y
Practices
no
for
transmisibles.
Non-Communicable
Este es el primero de
Diseases.
una serie
This
de
is the
actividades
first
online que
webinar
vamos a
of a
realizar
series that we will
y
be
hoy
carrying
nos
out
vamos a
online.
referir a las
And
acciones
today we will be
eficaces
talking
para
about
reducir
cost-effective
riesgos,
actions to
prevenir las
reduce
enfermedades crónicas no
risks,
transmisibles
prevent
y
non-communicable
promover la salud.
diseases, and
Tengo el
promote
gusto
health.
de darle la bienvenida al
It is
director
my
de nuestro
pleasure to
Departamento de
welcome
Enfermedades
the
Crónicas y
director of our
Transmisibles
Department of
y de
Non-Communicable
Enfermedades
Diseases and
Experimental,
Mental
el
Health,
doctor Anson
Dr.
Hennis. Doctor
Anselm
Hennis,
Hennis.
gracias.
Dr. Hennis, thank you. Thank you very much, Vanessa, and good morning, everyone. It is my great pleasure to welcome you to this first webinar in the series for good practices for prevention and control of non-communicable diseases, organized by the Pan American Health Organization. I would like to thank all government representatives, healthcare professionals, stakeholders, community members, colleagues from the international sphere who are joining us today. The Pan American Health Organization has promoted a series of strategies to respond effectively to prevention and control of NCDs. Amongst these issues to address the problem, we have the Better Care for NCDs initiative, which promotes a comprehensive approach from primary health care. These actions are aligned with the commitments made by member states at the United Nations General Assembly high-level meetings on NCDs, and they seek to accelerate progress towards more resilient, equitable, and people-centered health systems that can prevent, adapt, and learn in a timely fashion about non-communicable diseases in all levels of attention. This webinar is the first in a series of 3 that we have organized to promote the exchange of experiences and good practices that have contributed to effectively address this issue in our region. This is especially significant to be starting this series with a first session about cost-effective interventions to reduce risks, prevent disease, and promote health by acknowledging examples of good practices that have been identified by the countries and technical team of PAHO. I would like to take this opportunity to congratulate all governments who have shared their experiences, and particularly those who have been selected for this edition as examples of good practices. Your leadership, commitment, and innovation are a true inspiration for all of us, and they are the pathway to achieve the goals towards improving primary health. I have 3 key messages to share after considering the good practices that we will be analyzing today. First, sharing practices related to a healthy lifestyle, including a healthy diet, physical activity, and abandoning tobacco and alcohol use. This is essential to promote prevention. It is not only about treating diseases, but about creating enabling environments that will lead to healthy lifestyle choices for all individuals, regardless of their age group, living conditions, or place where they live. Second of all, many of these practices have achieved sustainable results because they have helped, because they have worked directly with the local communities, promoting their active participation and incorporating different stakeholders, local authorities, schools, civil society organizations, healthcare centers, amongst others. And this focus a, and community approach on primary health care is essential in order to improve the structural conditions that are determinants of good health. Thirdly, the good practices that have been selected represent a key contribution to address the current trends in the Americas, where unfortunately NCDs still represent over 80% of the total death rate. More than ever, we need to promote these initiatives further and scale those that are working well. Allow me to underscore another key aspect, which is prevention from early childhood. If we want to break the cycle of NCDs and their devastating consequences, we must act since the very first years of life to promote a healthy environment throughout our whole lives through mechanisms that will facilitate multi-sector action, healthy school environments, active play, a healthy diet, as well as limiting exposure to highly processed products and other harmful products are all essential steps to reduce risks of disease and child obesity. At PAHO, we encourage all countries to continue identifying, documenting, and sharing experiences, especially successful experiences. And that is why the initiative of innovation from our department has created the portal of good practices, which is a dynamic tool that will allow to give visibility to initiatives that have led to transformation to make learning easier, especially peer-to-peer learning. I wish you an inspiring session that will serve as motivation to continue innovating, collaborating, and moving forward towards the common goal of improving health and the quality of life of all individuals in our region. You have the full support of the technical team, the Department of Non-Communicable Diseases and Mental Health to continue strengthening the work in this area. Thank you very much and welcome. Thank you. Thank you very much, Dr. Hennis, for your inspiring words to kickstart our session. And as has already been mentioned, today we will focus on prevention of non-communicable diseases, NCDs. And to do so, we will be sharing some selected good practices that have already been validated by PAHO regionally, and they are available in the portal of good practices. These initiatives have been implemented in a series of countries, and they have proven to be effective in reducing tobacco use, promoting a healthy diet, as well as physical activity, together with reducing alcohol consumption. Let us begin with the presentations. Firstly, with our colleague Eliani Pereira dos Santos from the Portal of Good Practices in Public Health. Welcome, Eliani. Thank you very much, Vanessa, and good morning, everyone. I am really happy to participate in this event with everyone here. and to be able to share the methodology, the journey that PAHO has initiated to allow us to learn, document, and share good practices and successful initiatives. Please give me just 1 second to be able to share my screen with everyone, and I can begin with my presentation. Please confirm
Ahí está,
when you
perfecto.
can see it.
Muchísimas gracias. Entonces,
Now we can
antes de
see it. Okay,
anunciar
thank you.
los seleccionados,
So
quería que me
before
tomen la
announcing
atención de
the
ustedes
selected
para
countries, I wanted to
presentar qué son
first
buenas
introduce
prácticas
what
en salud
are
pública
good
bajo
practices in
la
public health
perspectiva de la Organización Panamericana de la
according
Salud.
to the
Las
Pan
buenas
American Health
prácticas para
Organization.
nuestra
So,
organización
good
son
practices
definidas
for our
como
organization are
iniciativas,
defined as
inversiones,
initiatives,
producciones,
interventions,
metodologías o
solutions,
procedimientos
methodologies,
emprendidos
or
durante la
procedures
ejecución de una actividad, de
in
un
order to
proyecto,
implement an
sea a nivel
activity or a
regional,
project,
subregional
whether
o local,
regionally, sub-regionally,
que
or
tengan
locally,
ahorrado resultados que
that
pueden
have
ser
led to
adaptados,
results that can then be
replicados o
adapted or
reposicionados en
replicated
diferentes
or
contextos
reused in different
en
countries by
diferentes
different
instituciones, países,
institutions,
territorios o
organizations,
organizaciones. Entonces,
geographical
tenemos como
regions.
premisa asegurar que
So
estas experiencias sean
our
bien documentadas,
attempt is
que
to
puedan
guarantee
ser
first that these experiences are
conocidas y
well
que puedan
documented so
ser
that they can be
adaptadas y
shared
replicadas
and
en distintos
adapted or
contextos. Esto
replicated in
es el
different
aspecto
contexts.
metodológico
This
crucial
is the
del
most
acto
important
de describir
methodology
y documentar una buena
and the
práctica.
reason behind
Tenemos la
documenting a
perspectiva
good
de que
practice.
haciendo
We
iniciativas
believe
como
that
estas de
with
convocar a
initiatives
Estados
such as
miembros,
this one
a nuestros
of
aliados
calling on
estratégicos que compartan
member
sus
states and
experiencias,
strategic
podemos
partners to share
ayudar a
their
que
experiences,
autoridades,
we can
tomadores de
help
decisión,
authorities,
profesionales,
decision makers,
profesionales de salud pública,
healthcare
comunidades puedan
professionals,
aumentar la visibilidad
communities
de sus
to
experiencias
increase the
conocidas
visibility of their
y
experiences,
asegurar
to learn from
también que
others,
la participación de
and
nuestra
guarantee
organización esté
that
presente
our
en desarrollo de
organization's
estos importantes
participation
proyectos
can
en
be
nuestra región. ¿Cómo
positive in
podemos
implementing
asegurar
projects in
que
our
las
region. So, how
experiencias,
can we
estos
guarantee that
proyectos,
these
estas lecciones
projects,
aprendidas también
experiences, and
tengan
lessons
contexto
learned
y puedan
can
ser
be properly
bien
contextualized,
analizadas y que puedan ser
assessed,
bien identificadas y discutidas?
identified,
Tenemos
and
como
discussed?
atributos fundamentales para
The most
facilitar esta
critical
documentación,
aspects
este
to
relevamiento de
guarantee
una experiencia,
the
algunos
documentation
atributos que son
of
mandatorios
proper
porque son
surveys,
ellos que
some of
van
these
a
are
facilitar
mandatory
tanto
attributes
a la
that
persona que
will
disemina,
make
que
it
documenta,
easier for
como también
those
a la persona, a la
documenting
institución que va a
the
recibir esta
facts, the figures,
experiencia,
but also for
esta
the
innovación,
institutions that will be receiving the
esta
data,
lección
the
aprendida
innovation, the
y
lessons
pueden
learned,
identificar oportunidades
and that
de
can then
replicación y
identify
adaptación
opportunities to
o
replicate,
adopción en
adapt,
su
or
mayor
adopt
efectividad,
those projects. So
costo,
the first is
efectividad, eficiencia,
effectiveness, cost effectiveness,
sostenibilidad,
efficiency,
la capacidad
sustainability,
de replicabilidad y
adaptability or
adaptabilidad, el
replicability,
entorno de cómo fue la innovación,
then
la
innovation,
promoción de uso de nuevas herramientas,
promoting the
tecnologías
use of new
para abordar
tools or new
problemas o
technologies to
identificar
tackle
soluciones
issues or
innovadoras
identify
y cómo fue el
innovative
proceso de
solutions. And
participación,
finally, a
sea en contrapartes
participatory
internas, socios
process,
que
whether through
promovieron un
internal
ambiente de
stakeholders or
discusión,
external
de
partners
identificación de
who,
rutas
through
y
discussion, have
que
identified
resultaron en una
pathways and
experiencia exitosa.
opportunities that led
Todo
to a
esto
positive
para
experience.
identificar los ejes
And the
macro
goal is to
de nuestra
identify
metodología.
the main
Primero,
lines of action of our
estos atributos
methodology. So,
ayuden a
first, these
documentar una
attributes
experiencia,
must allow
que
us to properly
faciliten el
document an
intercambio,
experience
que
that will
fortalezcan las
facilitate
redes de
exchange and
conocimiento
learning, that will
interprogramáticas, que
strengthen
faciliten la
knowledge
innovación
exchange
y
for
que nos
program
ayuden a
work, that
mejorar
will
los
facilitate
entornos, los
innovation and
sistemas,
allow
los
us to improve
proyectos, las
our context,
políticas
our
de nuestra
systems, our
región, que son
policies,
los tres
everything in our region, because those are the pillars that we base our work on. And that is why we wish to share good practices. We want to increase technical cooperation, improve the institutional capacity of PAHO, and strengthen partnerships with key stakeholders. This is a relatively recent methodology, and it has led to very special initiatives such as this call for good practices for prevention, control, and surveillance. We have published, together with the mental health department of Dr. Hennis, who already introduced our session, and Vanessa also mentioned it. This invitation for proposals was open in January 29 until March 21st this year. And in the first stage, we invited national governments from all our region, as well as intergovernmental organizations, to present proposals. We wanted to identify, document, and disseminate successful experiences related to addressing non-communicable diseases and promoting health and well-being of our local populations. That was the goal behind the call for proposals. And what have we learned? What did we discover through this process? What has been this experience that has brought us here today? The first step when we had the open call for proposal was to create the technical review committee, which is another important aspect of our methodology. It's mandatory, creating a committee that will guarantee the good practices, that the proposals will follow a series of validation criteria, will respect the attributes I shared earlier, and will respect the terms of reference included in the call for proposals. So as a result, we received 83 proposals from 17 member states, countries of a region, out of which 40 proposals were selected and shared in the portal from 11 of the member states. In this slide, you can see the disaggregated data of the countries, the member states that decided to participate, to submit their proposals. We rejected 5 proposals because they did not meet the requirements or the criteria, or because they were not able to document the data according to the methodology established by PAHO. We have shared back 17 of those good practices so that the original authors could answer questions from the technical review committee, make changes, and 21 were sent back but were not resubmitted before the closing of the first stage will be assessed in a second stage, so that they also have an opportunity to be assessed and eventually be published as well. Because the goal is to have in a second stage over 40 good practices shared in the portal. So before announcing the 40 and explaining to you how to access our first 40 proposals, we want to invite you to continue sharing your proposals, contribute to the initiative, share good practices. We want to learn from your successful experiences. There are so many out there that show innovation, that have a great potential to strengthen our work and our cooperation in the region. Please, the instructions are available in our website, and you will be able to find the attributes, the criteria. You can create an account and start filling in the forms available there. So please, this is an open invitation to continue sharing, to keep contributing, because we are more than happy to receive more proposals. And I also want to thank all the institutions, organizations, and member states involved. Thank you so, so much, because without the country's institutions, without the organizations that have shared and have participated according to our methodology, we simply would not be here. And I would also like to take this opportunity to thank everyone for the trust, especially the Non-Communicable Diseases Department and Silvana Luciani, head of the unit, her team, Luis Fernando Alarcón, Arancha, who is the communications expert who helped us to disseminate the information, and of course the review committee, Silvana Luciani, Vanessa Garcia, Luis Fernando, and Robert Caixeta, who reviewed. They have dedicated a lot of their time to work on this proposal. And finally, thank you to our consultant, Isabela Alvarenga from my department. She has worked very closely with me for her leadership and dedication that has really been a part of this call for proposals from beginning to end. And here, I also want to share my QR code and the link. It's a bit long, but I will be sharing it in the chat so that you can directly visit the website, look at the initiatives, and they're categorized by topic. You'll be able to see, and I'm sure we will learn so much. Thank you very much for the invitation. Vanessa, back to you.
Gracias, muchísimas gracias, Eliane, por esa
Thank you
presentación
so
tan
much for this
ponente y
presentation
contexto,
and for
los
giving
temas
us
y
the
la
context
importancia
of
que
all the
ellos tienen
main
para nosotros desde el punto de vista
topics
de
that we
nuestras
have
guías.
in terms of
Invitamos
the best
ahora a
practices.
la
Now
doctora
we are
Ariela
inviting
de Argentina, que nos va a presentar
our
la
doctor
buena
from
práctica de
Argentina. She
telemedicina
will be
para la intervención
presenting
tabáquica en atención primaria.
the tobacco control program in Tucumán.
Tiene 10 minutos. Gracias.
So you have Dr. Ariela, 10
Buenos
minutes.
días, ¿se me escucha correctamente?
Perfectamente.
I hope that you can hear me.
Bien, voy a compartir, díganme si se ve.
Okay, let me now share my presentation. Just let me know if you can see it.
Sí, no está en modo de presentación.
Ahí pueden ver. Bien.
Can you see it
Muy
now?
bien.
Okay,
Antes que
great.
nada, buenos
So
días.
before
Muchas
anything, let me
gracias.
say
Me
good
siento
morning.
sumamente
Thank you so
honrada
much.
de
I am
representar mi
so
país,
pleased to be able to be here
Argentina,
representing my
principalmente a mi
country,
provincia
Argentina,
Tucumán,
and my
que es una
province,
provincia del
Tucumán,
norte de
which is
Argentina.
a northern province in Argentina.
Agradecidísima
I am
con
so
los organizadores,
grateful with the
autoridades de la Organización
organizers and
Panamericana de
the
la Salud,
authorities of the
nuestro
PAHO,
gobierno
our
de
government
Tucumán,
in
el Ministerio de
Tucumán,
Salud de
the
Tucumán,
Ministry
así
of
como
Health in
Ejecutiva
Tucumán,
Médica,
now the Executive
excelentísimo
Ministry,
equipo de
and
trabajo,
their
por
great team.
Doctora Ariela, perdón,
sí.
I'm so
solo
sorry to interrupt,
aumentar
but
PowerPoint, no
we
como
cannot see the
presentación. Podemos
PowerPoint.
intentar nuevamente de
It is
ponerla en modo
not
de
presented
presentación.
as the
A
full
ver.
screen.
¿Quién más?
Parece que hay que salir y ir a la...
Hay que hacer clic en el icono que está inmediatamente junto al rango de Zoom.
Yo diría que... Sí.
Exacto. Veamos.
¿Y ahora?
No, vuelve al original.
We
Bueno.
apologize for the inconveniences. They're just trying to solve a little technical issue.
Pueden tener una mejor visibilidad. ¿No?
Déjame compartir, stop share, pone arriba, mira,
Tienes que seleccionar el icono junto a esa línea que está, que indica los porcentajes. Si haces clic en ese icono, se puede tener pantalla completa. Si no funciona, quizás podemos nosotros desde acá proyectar la presentación para ti.
Pone ahí. Y ahora más.
Ahí,
Let's see if you can see it now.
Ahí tenemos ahora la presentación en la siguiente slide. Solo
Y la configuración de visualización arriba.
They're
cambiar el
just
nombre.
trying to solve a technical issue. Please bear with us a minute. Thank you.
ahí, exacto. Ahí nuestros colegas están ayudando. Configuración de visualización.
Más arriba. O sea, se ve que tienen dos pantallas lo que pasa.
Tienes que ir a configuración de...
En la otra pantalla seguramente esté bien. Aparece como que tuvieran dos pantallas. Ahí.
Exacto.
Y cambia el primera opción.
Ya.
Ahí sí.
Bien.
ahí,
Muchísimas gracias.
ahí.
Perfecto,
Sí.
perfecto.
Perfecto.
Okay, apparently problem solved.
se puede
So
Correctamente.
I hope that you can all see it. You can see my screen. Yes, we can.
¿Sí? Bueno. eh,
Okay then.
Como les decía, muchísimas gracias.
So as I
por
was
esta
saying, thank you so much for this
oportunidad.
opportunity.
Yo soy la doctora Ariela Tarsic, soy médica
I'm
neumóloga,
Doctora
responsable del
Ariela. I'm
programa
a
de control del
pneumologist and
tabaco
I'm
en mi
dedicated
provincia de
to the
Tucumán.
tobacco control program
Voy a
in
hablar sobre
Tucumán.
las acciones
I'm going to talk
cost-efectivas
about
para
the
reducir el
cost-effective
riesgo y prevenir
solutions to
enfermedades
reduce
no
risk and to
transmisibles y
prevent
promover
NCDs
la
and
salud.
promote health.
Como sabemos, el
So
tabaquismo
as
es
we
una
all know,
enfermedad crónica recurrente que genera
this is a
infección
tobacco. It's a chronic disease that it's a current, recurrent, and generates addiction. And the World Health Organization recognizes this as a disease, is preventable, and it causes death, early death. Now, in Argentina, we have around 42,000 people who die each year due to smoking, out of which 6,000 never smoked. So that means like 50% were exposed to the smoking. So this means this is a serious problem in public health. So as of 2005 in Tucumán, we have they approve a law that it's the 7575 that enters into force in 2006, where as part of the regulation, we have this program called tobacco or smoking control program, and they are in charge of creating outreach programs so that we can have three purposes, that is prevention and stop smoking. That is prevention by means of education to our teenagers, our kids, so that we avoid them to become smokers, also improving the information and to stop smoking, that is by means of having free public doctor's office where we provide a lot of information as well as care for smokers. Now, since 2006, where we have the program that entered force until 2020, we had the smoking cessation program and publics, they were in person in our province. And the big challenge was to be able to continue with a smoking cessation program during the isolation in the pandemic. So we had to decrease the risk of complications from COVID in smokers, and at the same time to decrease the risk of exposure to COVID-19 when attending to the cessation clinics. We had, as I said, there were in-person doctor's office. So the idea was to reduce tobacco attributable morbidity and mortality in the province of Tucumán, and to decrease tobacco use and exposure, to strengthen the patient adherence to the smoking cessation treatment, and to adopt healthy lifestyles. So we always had a comprehensive approach with a universal and free access to consultation, as well as a pharmacological treatment, regardless of their social status, gender, ethnicity, and economic status. We wanted to include the virtual modality into the program, and it was a huge challenge. We had a multidisciplinary team that was very important for us because tobacco treatment is not only just of having one expert. We needed several experts. We needed psychologists, psychiatrists, etc. And the specific actions that we included as of the pandemic, it was to generate a virtual platform with a virtual office and care system, with medical records, and also to have a shift generation. What were the levels of care involved? It were all of them, first and second and third, always with a referral, counter referral. What were the channels that we used? Well, an app in the phone that it was very easy to use. They just downloaded an app on their phones and they could ask for a consultation, or also we had a virtual public hospital and toll-free phone lines that in Argentina we call them 0800 lines. So what were the results that we were able to measure and that they were really important? Now, we divided the part before the pandemic, that is before 2006 until 2020, with a 100% in-person modality. And from 2020 to 2022, that we went virtually, and from 2022 to 2024 with a dual or modality, that is in person and virtually. So until 2022, we were able to see that we kept the same amount of patients with a similar success rate. But then when we went to the virtual modality, and after the pandemic, where we were able to open our offices again, and the idea was to be able to keep the virtual modality from 2020 to 2024, we noticed an increase from 470%. That is the amount of patients that came to the offices, both virtually as well as in person. And we wanted to keep the success rate that the expected was from 25 to 30%. And during all this period, we kept the rate in excellent condition. So what were the changes that we observed? Well, without any doubt, an increased demand for care, great addition from behalf of the patients. We generate patients that became health promoting patients because it was in person, it was individual, it was in groups. We had a multidisciplinary approaches where we tackle all the aspects from the patients, because the dependency is not only chemical to the tobacco, it's also psychological, also social, also behavioral, where each one of the links of these human resources that we had available, it was very important. And what was another lesson that we learned is that the patient had a sense of belonging where with this dual modality, and we generated a community. Now, what were the resources that were needed to this virtual care? Well, the truth is that it was at the beginning very basic, and it was easy to reproduce. That is the technological innovation. We needed devices, phones, computers, audio, infrastructure, programming, a communication and connectivity systems, and also the know-how, both from the patient as well as the health professionals. It was easy, replicable, it was accessible and affordable. Now, what were the institutions that participated? We have the Ministry of the Health of the province of Tocan, the Provincial Health System, Integrated Health Systems, the Digital Health Directorate, the Virtual Public Hospital, the Provincial Tobacco Control Program, the health institutions for the first and second and third level of care, always with referral and counter referral systems, and the civil society with a great cooperation and a huge adherence of this new form of care. No matter the age, the patients adapted without any further issues. And now we don't have a lot of time, but I just wanted to show you some images of our work. In this case, the virtual assistants, where you can see, for example, on the left, that's me with our team, the audio team, with a video call system implemented, and on the left you can see the doctor making these activities for the patients and techniques of breathing together with a group of patients. She's showing them how to work, and the image on the right and in the right side, the way that we work with physical education teacher and the psychologist. And lastly, I wanted to show you some other videos of how in the virtual world and also as well as in person, we had a school of patients that were with that had some breathing or problems, and looking for the screening of other pathologies that were related to tobacco, and also where they were experiencing other diseases, and how they were, making some physical activities. Let me show you the video really quickly. They had COPD, some of them, for example, and I just wanted to show you testimonies of the patients, of what they truly experience on a daily basis and how they feel about this dual modality, of this huge opportunity that we have. And we believe that telemedicine is something that now is here to stay, so that we can combine it with in-person care, and this allow us to provide a much better service. Let me just show you a quick video of patients. I wanted to stop smoking. I knew that this was not good for me, and I just asked for help. I just wanted to stop smoking with the help, so I came in for help. I am perfectly capable of overcoming this dependency. The fact of stop smoking for me was very important, and I just wanted to go back to myself, and I know I'm going to be able to make it. Let me tell you that 2 months ago, I stopped smoking. It was hard, but at the end, I managed it. So I am very grateful, because the achievement of each one of us, it's a group effort. So thank you so much, and let's keep going. I haven't touched a cigarette in a while, and I know that I'm going to be able to make it. I joined the group of people that wanted to stop smoking, and with dedication and help, I managed. You can stop smoking. If I was able to do it, you can do it. And now I feel free of it. And always ask for help, because we have excellent professionals that will help you stop smoking. The interpreter apologizes. The sound was not the best, but I hope that I was able to convey the message. Okay, then that's all on my behalf. Thank you so much. Thank you, Dr. Ariela, and thank you for those testimonies that, of course, is very inspiring. We will have at the end of this webinar a Q&A session where we may be able to discuss in further detail all these important elements and findings and conclusions. Now, I'm going to pass the floor to Dr. Matias from Chile, and he will be presenting sustainable transportation for students. Hello, everyone, and good morning from the Ministry of Health in Chile. Let me just share my screen really quickly. So first of all, I'd like to thank everyone for the space and for being able to be here. Besides just presenting these, I just want you to understand a little bit of the dynamics and the challenges that we have in Chile. The topic that we will be presenting today, if you can see it, yes, please just remember to change this to a full presentation mode.
Todavía no. Perfecto. Gracias, Matías.
Gracias. Bueno, agradecer el espacio y nada, convocar un
Great,
poquito a
thank
que
you,
esta
Matthias. Well,
presentación
no,
sea
thank you for giving me this opportunity,
un lugar en
and I do hope this presentation will allow us to think outside the box, I would say. It's an invitation to emancipate ourselves from the sedentary lifestyle that we have. And I believe that we will be looking at a very complex situation for our children and adolescents. We are seeing very high rates of inactivity, and it is up to us to find solutions that will improve their lifestyle, their well-being, and their overall health. So I will try to very briefly go over some facts and figures and then be open to questions. So first of all, the context, the situation that motivated the intervention. In Chile today, 7 out of 10 children do not meet the minimum recommendations of physical activity that PAHO has. That means that they are very inactive. They do not have the benefits of an active lifestyle. And this, of course, is a risk factor for them. They simply will not be able to have the health that we seek to promote in the Ministry of Health. There is also a gender gap between girls and boys. And if we analyze the transportation, we see that there is a 10% difference in terms of children walking less. So in the past, perhaps this was part of the normal development of children. We were always very active. This is something that everyone understands to be the nature of children, just moving, walking, being very active. And we, as grown-ups, all of us who are grown-ups today, at some point maybe walked to school, but what we see today is very different. The level of inactivity today for children is 66%, which means we are referring to this new generation as the backseat generation. They are simply being driven from one place to another. They do not have a chance to be active, to be moving. And if we analyzed our political framework, we saw that it was imperative for the Ministry of Health and the Ministry of Sports and Physical Activity to think of an intervention to promote urban public activity, physical activity. Since 2017, we introduced bill of law to promote physical activity of up to 60 minutes, of at least 60 minutes in schools to promote a more active physical environment. That's what PAHO promotes, and that's what the evidence points to being necessary. So this was a very important part of the strategy also to fight obesity amongst children and adolescents because the rates have been very high. So this strategy began in 2023, and the idea was to promote active transportation. So we wanted to create a stronger framework from the public policy level to promote physical activity. So what are the goals and the targets of this intervention? First of all, the pilot meant to implement the Active Transport Guide, promoting the use of active transport and strengthen collaboration of all school community and the municipalities involved. This is recurrent, and the idea is to improve physical activity or increase physical activity because according to the evidence, it was one of the most cost-effective interventions. So improving road safety and creating a sustainable pilot project that could then be replicated, as well as raising awareness about the benefits of active transport. It's a multi-sectoral approach with the Ministry of Health as leader, but with a series of other organizations and ministries of the Chilean government, the Ministry of Sports, Social Development were involved, as well as the National Road Safety Committee, the Ministry for Transportation, the academia, PAHO, municipal governments, and we sought to establish a pillar which was also to reduce gender gap. We wanted to encourage both girls and boys to participate. Then the territory we wanted to implement in several areas of the country, in the metropolitan area of Santiago de Chile, in the region of Los Rios, two very important regions, because a big cultural problem we have regarding active transportation is also because of weather conditions. And in these regions, this is the south of the country, where the weather is more rainy, it's more humid, so weather conditions make it a little bit more difficult, and that's why we thought it was interesting to pilot this project in that area. Also, considering Best Buy, one of the most relevant ways to tackle non-communicable diseases was to promote good health through physical activity as a factor to reduce risks recognized by PAHO. So that's what we sought to promote. And our approach had, again, the municipality at the center, because the municipality would be in charge of finding the schools that would be implementing the project. And we were there to support with the economic resources and all other resources necessary to implement the model. We had the opportunity of sharing this experience from Pies in Bogota. They shared their protocols and experiences. Bogota has been doing this for a long time, and it's a very, very rich experience that they have to share, and we were very grateful to have their partnership. So we promoted the Guide for Active Transportation. It's the active school that was promoting direct active transportation. It was a participatory model. We proposed every school to have their own strategic plan, having a route that they themselves drew with the collaboration of parents, tutors, guardians, school teachers, government authorities. Students themselves could also participate, as well as the municipal government. So we made the commitments formal with families as well. It was important to get the grown-ups to commit to leaving their children at the starting point and picking them up, guaranteeing the safety and security of citizens. The Ministry of Urban Planning, Health, Sports, Educations, even trade, they all participated, because even stores and locations in the route that was drawn were able to offer either shelter or even a restroom for children if they needed it. And the results allowed us to understand, well, first of all, that participants were highly motivated and they stuck to the program. There was a true change in mobility. There was a perceived improvement also of road safety, benefits perceived in the family because of the both logistical and economic support received by families. And there was a program in Chile called Chile Cuida, or Chile Cares, and grown-ups participated because it helped them as well. A time that they dedicated to taking their children to school was a time that they could now dispose of for other activities. Children themselves were more motivated, they were happier when they got to school, and values are also promoted. The community becomes stronger, not only in school, but also outside of school. Even younger children start getting to know older children on the way to school. They associate better, and their social capital is now stronger, more structured, which leads to a lot more trust and confidence amongst groups. Habits improved, We saw an improvement as well in road infrastructure, and the intersectoral approach was key to guarantee the sustainability and success of the program. If we do not coordinate well, it is impossible to implement these projects successfully. Communication and awareness are also very important. It was difficult at the beginning because of security as well and perception of security. Grown-ups who were involved were a bit reluctant. They did not want their children to participate in the program because they were concerned. They were scared of road safety, but also potential thefts. And little by little, this anxiety was also combated because they saw that the community was very supportive, and the communities really claimed ownership of the program. That again led to long-term sustainability, more flexibility in implementation, because what we saw as we were developing the guide together with the different sectors and considering the experience from Bogota, we saw that contexts are also ever changing and we have to adapt. Sometimes, again, because of climate change or weather conditions, sometimes you have to change the route that was originally traced. Matias, I am very sorry for interrupting, but your time is almost up. Maybe just one more minute to wrap up so that everyone has the same time to present. Yes, I'm sorry. I'm sorry about this. I'm really happy with this project. I hope it continues to be carried out because it's so much fun. At lunchtime, we have different things to play with. I also feel more energized to do my schoolwork. We get along better, we're happier, and we do more physical activity. What teachers have identified is that children are now more awake during classes. I would love for this project to continue, for it to be done more often, that more parents would trust because teachers are always there writing the messages, texting them, and I think that helps to make everyone feel safe. We hope this project will continue every year and be replicated in every school because it's something that was truly missing in our region. Thank you. Thank you very, very much, Matias. I propose that we leave it at these. And of course, all of the details related to the impact and replicability can be also addressed during the Q&A. Thank you so much. And now I would like to welcome our colleagues from Colombia, Dr. Carolina Camargo Restrepo, who will present to us healthy lifestyles and primary care to control non-communicable diseases in El Cauca. Thank you very much, Dr. Carolina. You have 10 minutes. Thank you very much. I'll be sharing my screen.
¿Me confirma, por favor, si ya se ve?
Please confirm if you can see my screen. Yes, we see it now. Thank you. Okay, I'm Kelly Joana Tello Hoyos, and I will be sharing the presentation from the Department of El Cauca, Colombia. Thank you very much to PAHO for the opportunity to share our experience. And first and foremost, I would like to thank the technical team who has been supporting us since 2016 and all stakeholders who made this strategy possible within our department. I will share how promoting a healthy lifestyle and primary care are essential to control NCDs in Cauca. We are in the southwest of Colombia. There are about 42 municipalities in our area. Our population is mostly ethnic. 24%, almost 25% are Afro-descendants and almost 20% are indigenous. And there are many difficulties in accessing healthcare because of geography, infrastructure, etc. So why did we decide to focus on non-communicable diseases? Because they are found in our top 10 morbidity causes. About 210,000 people have diseases that lead to hypertension and diabetes, and 240,000 people die every year because of complications from these diseases, especially cardiac arrests. So what were the goals of our strategy? We have a large framework, which is implementing a strategy called Healthy Cities and Environments that aims to have sustainable communities and sustainable healthcare within communities. And it has three goals. First, to implement actions that promote healthcare through the involvement of different sectors that can help to promote a healthy lifestyle, especially physical activity and healthy nutrition. We also have strategies of information, education to raise awareness with the local population so that they can adopt the healthy lifestyles and we can promote self-care. And finally, to do capacity building in terms of human talent so that risks can be identified early, diagnosis can be done early of non-communicable diseases. And there are three main lines of action. Firstly, it's intersectorial, our approach. We do public health management. And finally, we have a main intervention plan called the collective plan. Plan de Intervenciones Colectivas. And this is how we promote primary health care. In each of the 42 municipalities, we are working on a rural area, a micro territory, and we have a local intervention team that's there implementing activities. And it's a nurse, an auxiliary, an expert in physical activity, a psychologist, and an expert in environmental sanitation. And we are working at schools and the community. Let me explain more specifically what we're doing in schools to promote healthy lifestyles. In 2023, we started by preparing a series of information that we worked together with the Caucas healthcare sector, and we identified some of the risk factors that led to obesity, diabetes, and cardiovascular diseases. And we try to promote knowledge about these areas and also choose essential actions in mental health and promoting healthy lifestyle in general. In schools, we also have implementing what we call orientation areas in order to mitigate mental health issues that have been identified, including drug use, suicide attempts, bullying. So an initial response has been to implement these orientation areas where we can identify these issues early in the schools so that they can be addressed. Regarding skills for life, we believe that education about healthcare should be involved in school curriculums. So to achieve this goal, we have done two things. First, to create a curriculum of skills for life that includes knowledge about healthcare, public health, and with the healthcare institutions, we created a guideline so that the Ministry of Education nationally can include this guideline in school curriculums so that education for a healthy lifestyle can be implemented in schools. We have received support from the Antioquia University for this. And finally, we have also implemented both classes and active breaks or lunch times, as well as working with the local cafeterias that are selling food products at schools. In 2023, after analyzing the situation and preparing the information, we identified leaders that can help teach this information. And we created this program with the University of Cauca to empower local leaders so that they learn about chronic non-communicable diseases so that there's early identification, but also a focus on prevention. The process, by the way, is fully certified by the University of El Cauca, and we have also promoted a healthy lifestyle by organizing physical activity groups, sports groups that meet 3 times a day, and others that meet 1 time a day through an intersectorial project that we have done with the Ministry of Sports. And by implementing this strategy in the 42 municipalities through a technical expert, we have managed to to guarantee the continuation of this activity. With the experts in the department, we also created a diploma course of cardiovascular risks to promote, again, human capital, human talent, skills building, so that they learn about non-communicable diseases. We have done it with the University of El Caucas and with the local ministries, as well as the University of the Los Andes University, to identify what teachers and professors know in the area so that there's more information to control non-communicable diseases. So a thematic curriculum will also allow to identify and create strategies better, assess them, and eventually manage things better. Let me share the results that we have found. We identified almost 59,000 families, 113,000 individuals, and some risks identified. We identify healthy lifestyle practices, about 894,000 individuals with risk. We have tried to address so far almost 24,000. As far as individual risk, we also identified 842,000 alerts, and we have worked with 11,000. We have trained 336 individuals of basic teams.
Now, we did an evaluation back in 2020 with the Andes University, and we were able to identify that we have this cost-effective interventions. For every time that we invest, we receive a ROI of 1.7 pesos in activity, and we've generated a lot of health journeys, and we've formed around well, a lot of leaders trained, 345 trained teachers. We also created a platform so that the process of information that is already available, we're going to have a first course on 2026. And with this diploma courses, we have two cohorts. In 2024, we certified 80 people, and this year we have already 200 people enrolled. Now, regarding the factors that make it replicable or scalable, we've done a planning joint effort. We have participation from the community in the participation in planning and implementation. And mainly what we've done is that we need to support on the chain so that they help us with the documentation and the evaluation of all the strategies that we have available. And we are within the creation of an observatory that would allow us to have the analysis of the information to define monetary key factors to be able to give follow-up to everything. Now, we've done all the process of documenting and defining the topics. Now, what are the areas that we have as part of our government? We are working with key players. We're working with different organizations in deportes, also with local university, Maria Cano, La Universidad del Cauco, infirmary program, the electronic program with the University of Los Andes, with the School of Medicine of Los Andes, with the University of Etioca, with the OP, the PAHO, the Ministry of Health, and some other local identities like Kili Salud and Ese Norte 3. I apologize. Oh, no. Oh, sorry. You are done. Thank you so much. We are just right in time to go to the next speaker. I see that there's a lot of interest on the chat that, of course, this reflects a lot of work between sectors and the successful implementation that is very useful for us. Now, let me pass the floor to our colleagues from Guatemala. Juan Diego Blas, he will be presenting active, passive, and healthy communities. Can you please go back to our presentation if you can, please? just put the chronometer so I can comply with the minutes. Thank you to the Pan American Health Organization, the PAHO, and we want to share the best experiences that we have in order to replicate this in all the countries. I'm Juan Diego Blas. I work for Guatemala. I'm a physical education teacher. And active cities. Let me just tell you a little bit of what this means. Now, where does this come from? Well, the context of this active cities, now currently, and next week, we're going to launch the first time in the history of Guatemala that we have a national policy. That is because there's an insufficient practice of physical education, physical recreation in the sports in Guatemala, and this affects, of course, health, participation, etc. So in order to be able to tackle this problem, one of the main projects that we're working on is the active cities and healthy cities. Now, why do we need this? Why do we need active cities? We already heard about this in other presentations, that there's a lack of physical activity in teenagers. More than 86%, they don't have enough physical activities. 6 out of 10, they have sedentary life. And we have more than 3,000, for example, homicides in 2022. So we hope that, for example, sports help us to prevent homicides and violence, also diabetes prevention. There's a high burden of these, hypertension, diabetes in urban areas. We have more than 220,000 cases. And the idea is to be able to activate the population. This is why. Now, what is the main objective of the project? To promote healthy, safe, and sustainable environments that will encourage active lifestyles and the idea is to work through the municipalities. We have 22 departments and 340 municipalities, and the idea is to be able to focus on what these municipalities are doing, and based on some criteria that you will see in a minute, we are going to give them a certification of specific and healthy cities. The program is divided in different parts that will deal with each one of the topics. The strategies is through a community physical activity, to have a healthy urban environment, local institutions, because as you will see, we have a lot of institutions involved in this program. We have a culture of peace and coexistence in order to avoid violence, social participation, and the right-based approach, because we have a lot of issues regarding inclusion, etc. Now, as part of the best buys that we have in the PAHO, there's one that is to promote physical activities, and we will create campaigns. One of the main axes of the program is to be able to promote all the activities in the different municipalities, and also to be able to provide counseling and help to bring about all these behavioral changes. And this is what we do through CONADER, to give this follow-up in order to promote the changes that we are expecting. Now, what are the main actions for the good practices? First of all, to have a manual. The manual has 54 activities with help of different institutions, and the municipalities may choose one of their main activities. Some activities give you 100 points, or depending on the difficulty of these activities, and the manual serves as a guide. Now, from this also, we created an evaluation and strengthening, that this is what they establish, all the indicators of these 52 criteria, so that the municipalities know exactly what we're expecting from this, and also to have the system and how to assess this. We do this by department, and then national, and then we have a commission that is in charge of analyzing this. We've created some active cities congresses in order to be able to strengthen what we're doing, the best practices, in order to have active cities. Colombia is very advanced in this part, and this is one of the main certified countries, and we have them certified by the municipality that handles all these methodologies. Now, what do we do? Well, we have one-on-one meetings with the municipalities. We ask them to register. We also monitor. We give them evaluation techniques. And finally, they are already applying for their certification. So there is a certification delivery process that in November of this year, we will have our third Congress. And that's where we are going to be able to award at least 20 certificates and to the municipalities, and also we have all the main actions for these good practices. Now, what are the benefits of the cities that are designed to move around? You all are experts already, but we just need to mention some of them. We have happy citizens, more inclusive cities, with everything that has to do with social inclusion, also people with certain disabilities. Also, we have less crime, safer pedestrians, bikers. The most important thing for the PAHO, which is one of our main allies here in Guatemala, is that we want to have less stress, less diseases, NCDs, to have more active schools, that we already heard about this in the previous presentations. And something really important is that the most of the actions are centralized in cities, in the capital in Guatemala. So through the different councils, because we have 22 departmental councils, we decentralize this strategy so that they go to all the 22 departments of the country. Now, what are the results or the impacts achieved? Well, we have already 64 municipalities enrolled in the program in 22 departments. So that's how we reach to the national level. And through this, we have the country divided in 9 regions. We have 9 regional coordinators who will be visiting all the municipalities. We give a follow-up. They verify that all the activities are implemented, and we have more than 15 interinstitutional alliances. Now, in terms of best practices, as part of the programs, we have the 5 axes, that is active municipalities, systematic process of sports development, and this is one of the part that we see the higher performance. We are working with 4 organizations that I'm going to confirm their names, so we also have that part. And also the program is more focused into physical activity, sports habits, infrastructure, sustainable mobility, infrastructure, parks, recreative parks that will be open for everybody, and also promotion and dissemination. And we have all here, all the municipalities that are already participating in each one of these lines of action. So the idea is that these will be awarded in the Congress. Now, what are the things that we can replicate? This is a flexible model that it's adaptable to diverse municipalities, and they select which ones they can select, which ones they can do. They're all aligned with sustainable development, and also what we have in the World Health Organization. And the idea is that all the programs are managed by the institution, and the only thing that we did was to join them. That we have a program that we do not have a lot of budget, but well, the idea is to be able to handle this by institutions. And the truth is that they have told us that this is a very innovative system, because what they have at the international arena, which is the creation of the sport for everyone, and they identify cities at the worldwide level. And at the beginning, back in 2020, this was one of the main ideas, to certify Guatemala. But we saw that this was a better or more interesting project to certify Guatemala. Maybe in the future, we may be able to certify one of these at the international level. But the most interesting thing about this, and the innovative part, is that there's no other country doing this, and they're having this national certification. What are the key players? We have the CONADER. We also have alliances with all municipalities, universities, with the Ministry of Health of Guatemala, PAHO, local communities, youth communities, sports promoters. They have helped us a lot, UNICEF, UNESCO. And in order for you to understand a little bit the scope of this, we have the CONADER, which is formed by 4 organizations, and this is what I'm telling you. We have the COG, the CDAG, the Ministry of Sports, and the Physical Education Ministry. These are the 4th parts that we coordinate. And the beautiful thing about this is that this project has more than 15 organizations. We have all the names over there. We have the private organizations too, and this is the beauty of this. At the end, let me just share some of the pictures of the things that we've done, how we are, doing a lot of dissemination process, and we have active work, and we are so pleased of the results. And we have, for example, private organizations that they're helping us to be able to create bike roads. And Antonio Blasco says that an active city is one that prioritizes the health and the well-being of the citizens, creating environments that encourage physical activity and healthy living in everyday life. So I'm here for you. If you have any questions, please let me know. And thank you, Pajo, for taking us into account for
Muchísimas
this
gracias, Juan Diego, y
presentation.
felicitaciones por esta iniciativa que sin duda
We congratulate
traspasó
you
las
for
fronteras
this
de la ciudad
initiative.
capital y se ha extendido de forma tan impresionante
And
en
this is
el
something
resto
that
del
you
país.
expanded to the rest of the
Espero poder
country.
tener algunos minutos para invitar
I hope
a
that we
todos
can
los
have
participantes a
some
hacer algunas
uh,
preguntas.
moments
Pasamos
at
a
the
la
end
última
to ask questions.
presentación
Let us
para
go to the
darle la
last
bienvenida a la
presentation. I
doctora
want to pass
Patricia
the floor
Fuentes
to
de México y
Doctora
que nos va a
Patricia
presentar
Fuentes from
las buenas
Mexico. She will
prácticas de
be
prevención del
presenting
consumo de alcohol en adolescentes con
the
las
good
apps de
practice
pasa si te pasa.
with the to prevent tobacco use in adolescents. What happen if you go too far, let's just say.
Buenos días. ¿Sí me
Bueno,
Good
escuchan?
morning, everyone. I hope that you can
sí,
hear me.
pero no está en modo de
Um,
presentación aún.
we need you to change into presentation mode, please.
Ah, no,
Gracias.
ahí está en doble pantalla. Tenemos que ir a nuevamente configuración de
We
visualización.
want you to please check your configuration before we start.
Perfecto, muchas gracias.
Thank you so much.
Muchas gracias. Primero agradecer a la Organización Panamericana de la Salud la oportunidad de compartir con todos los participantes en esta ocasión esta práctica
First
que
of
hemos
all, I'd
desarrollado
like
en
to
México y que se
thank you
denomina
for
la
inviting us. We have
intervención
this
¿Qué pasa si te pasa? Que es una intervención
an
preventiva del
intervention.
consumo de
This is a
alcohol, tabaco y otras drogas
prevention
para adolescentes.
technique for
Lo que
alcohol
estamos
use
presentando es
in
la correcta
adolescents, where we are
efectividad
presenting the
de la,
practice of
de
the
la intervención.
efficiency of
Bueno,
intervention, on-time
para
intervention.
contextualizar, podemos
Now,
decir
in
que los
order to give you
estudios
some context, we
epidemiológicos
can tell you that
indican que los
epidemiological
adolescentes
studies
mexicanos
indicate that
en
Mexican
términos anteriores
teenagers, as well
tienen
as in
alto
other
riesgo de
regions,
consumo
they
de
are
alcohol,
at
tabaco
high
y otras
risk of
drogas,
consuming alcohol,
principalmente por
tobacco,
tres
and other
factores. El
drugs
primero es el
because
consumo que inicia a edades
the
cada vez más
consumption
temprano.
begins
El
at an
segundo,
early
que la percepción
stage.
de riesgo ante ese
Perception of
consumo
risk
es baja.
towards its
Y la
consumption is
tercera, que hay
low.
una amplia
And
disponibilidad de
thirdly,
estas
there's an
sustancias.
availability of these
En
substances.
cuanto a la percepción de
So,
riesgo, hay
regarding
evidencia
risk, there is
científica que indica
evidence
que a mayor percepción de
that the
riesgo se puede
probability of drug
generar
use
dinámicas
is
protectoras
associated with
en
low
los
perception in
adolescentes.
harm.
Las investigaciones,
So the
pues, muestran que
investigations now
un
show
mayor
us
nivel
that a
de riesgo
greater level
percibido
of risk
disminuye
perceived
la
will
probabilidad de un
decrease the
comportamiento de riesgo.
likelihood of having a
Además,
risky
de acuerdo con la
behavior.
Organización Mundial de la Salud,
According
la
to the
adolescencia es un
WHO,
periodo
the
óptimo y
teenagers or
ideal
adolescents is an
para hacer
ideal period
prevención y
for
prevención
prevention and
debido a la
intervention
neuroplasticidad del
due to the
cerebro adolescente y a
neuroplasticity
la
of the
posibilidad de
adolescent's brain and
intervenir
the possibility of
justamente
intervening
cuando se
when
inician conductas de
risk
riesgo,
behaviors
tales como
begin,
el consumo de
such as
sustancias.
consumption
Por
of
ello,
substances. So
recomiendan
for
implementar
that, we
intervenciones
recommend to
psicosociales
implement
universales en
universal
adolescentes
evidence-based
basadas en
psychosocial
evidencia para
interventions
promover
in order
tanto
to
la buena salud
promote
mental como la
good health,
prevención
good
de
mental
las
health,
conductas
as
de
well as
riesgo.
to prevent
En este
risky
marco,
behaviors. With
en
this
el Instituto Nacional de
framework,
Psiquiatría, donde yo colaboro
in
como
the
investigadora en
Institute of
ciencias médicas,
Psychiatry, where I
tiene una
work
línea de
for, we
investigación
have
sobre
an
prevención
investigation line of
prevención en adolescencia
prevention
en
in
los temas de
adolescence
adicciones y
and
en los
also
temas de
regarding
violencia.
addictions and also violence.
Desarrollamos una
Now, we
intervención
develop
denominada
an
¿Qué pasa si
intervention
te
called
pasa?
What Happens
Y en la
if you go
segunda
too
fase de
far?
esta
And in the
intervención
second
es la
phase of this
evaluación de la
intervention is to
efectividad
be
de la
able to
intervención.
assess the
¿Por qué?
effectiveness
Porque
of
la
this
literatura
intervention.
internacional nos
Why?
dice que
Because
es muy
international
importante
literature says
hacer la
that it's very
intervención,
important to be able to make
aplicarla,
this
pero es
intervention,
más
to apply
importante
it.
aún
But the most
evaluarla.
important thing is to
Entonces
assess it.
nosotros nos dimos a la
So this
tarea
is why
de
we are
desarrollar la
dedicating
intervención
to
y después
develop
evaluarla.
interventions and
¿Cuáles son
then
los
to
objetivos
assess
de
it.
esta
What are the main
intervención?
objectives of this
Primero
intervention?
es
Well, first of
aumentar
all,
la
we
percepción
want
del
to
riesgo
increase the
hacia el
perception of
consumo
risk
del alcohol, tabaco y
of
otras drogas en
alcohol
hombres y mujeres.
consumption and
Y
also
tomamos
tobacco and
esta
other
idea
drugs
de la
in
percepción
men and women.
justamente
So
porque es
we
uno de los
take this
factores que están
perception
predispusiendo
idea
que
because this
apoya
is
la
one of the main
epidemiología.
factors according
El
to the
segundo objetivo es
epidemiology. The
fortalecer
second
habilidades
objective
para
is
la
to
vida
strengthen life
en estudiantes
skills
mexicanos, tanto
in
de nivel
Mexican
secundario como
middle
de
and
nivel
high school
bachillerato, que
students.
es a quienes se dirige esta
This
intervención.
is what
¿Cuál
this
es su marco
intervention is
teórico?
addressed to. Now,
Esta
what is
teoría
the
del
theoretical
aprendizaje social
framework
de
and the
Bandura,
approach?
que
This is the
postula la
Bandura's social
importancia
learning
del
theory
aprendizaje
that
agrario basado
explains
en el
uh,
movimiento.
how we can assess this based on a model. Now, according to the approach that we have, is the WHO Health Skills Model of Health Protection and Prevention of Risk Behaviors with an adaptive and positive psychosocial behavior approach. Likewise, from this approach, the psychosocial adaptive positive behavioral skills help adolescents to effectively cope all the challenges of their daily lives. Now, this intervention at the cognitive level facilitates the acquisition of knowledge about the effects of alcohol and other drugs on the brain because it contains scientific information and uses a textual and visual language to facilitate understanding. It is based, as I was saying, in this intervention in a resource that I will be sharing in a minute. Now, it also increases the perception of risk towards the consumption of alcohol and other drugs, and the behavioral level reinforces and improves the ability of adolescents to relate with their peers, to resist peer pressure, to use drugs, to solve problems effectively, and to make responsible decisions while being aware of their consequences. Now, let's go to the evaluation of the effectiveness. Now, the objective is to assess the effectiveness of the intervention regarding the knowledge of the effects of alcohol and drug use and to strengthening life skills and to increase their risk perception. What is the model of study? Well, there is a quasi-experimental pre-test and post-test studies that we carried out with students using an online version of the intervention. And in this time, we have a sample of a public school here in Querétaro. And the truth is that this intervention may be applicable in different states in Mexico. And we have decided to apply this in a total of 10,000 students between different levels. And how do we do it? We measure this with a questionnaire, and it has several dimensions: social demographic, a knowledge about alcohol and other drugs, the risk perception. And let me say that the knowledge that we are applying in these interventions were reviewed and approved by experts as well as teachers were able to approve all these questionnaires. And lastly, we have a reactive that is to measure the results. And something very important, in order to be able to measure the skills for the strengthening the life skills, we have a scale that can be used in schools and community centers where we apply this. So likewise, we train the health professionals. We have 40-hour training where we train them in all this content, and we train health professionals as well as teachers so that they can apply this. We apply this in 10 sessions. What I'm sharing with you is the alcohol consumption and alcohol consumptions and other drugs that are related. So it indicates that the baseline, we can find that the alcohol consumption amongst teenagers, it's at least 63% and almost 40% in the last 3 months. So once that we apply this intervention with all this, we have an experimental and a control group. And what I'm showing you here is that we can show you all the minimum numbers, and we have an increase of knowledge. We also see an increase of skills, for example, in order to be able to have resistance, to be able to make better decisions, assertiveness. And I'm not mentioning all of that because of course, it's a lot of information and very little time. But in order to be able to add up this, we will have a risk perception change. This is the main variable of this measurement. So we assess that the student, for example, says that this substance is not risky or dangerous. So what we want them is to be able to identify what are the risky things. And in the pre-assessment, we have 44% and increases afterwards in a 63% the risk perception in teenagers. This is generally the perception that we have in the rest of the groups.
Regarding the impact, here you can see how the intervention did. And this is interesting because we can see the format being used in schools. It's easy to adapt, it's easy to replicate. And here you can see the key stakeholders, which are schools. And this is another interesting detail about the intervention, which you can also analyze if you look at the portal, is that it has already been assessed and used in secondary education, so middle school, high school, and also I believe it can be used regionally because the scale is quite significant. I will leave it at that because my time is up, but thank you. Thank you, Dr. Patricia. Honestly, I'm looking at the comments that have been shared in the chat, and it's truly inspirational to see that there are indeed public health effective interventions that can support teenagers, young people to stop drug use and drug abuse. We have some time for questions, and I see that in the Q&A section, we have some questions already. Well, we have greetings from Chile, Punta Arena, La Patagonia Chilena. So thank you. That's wonderful. Welcome, Dr. Lidia Morales from Chile. Let me see. There is a question sent by Carlos Garcia. The most common dental health problems have been categorized already as non-communicable diseases. Can you tell us if this public health issue is already being addressed as an NCD? Today we're looking at situations that are associated with risk factors for NCDs, but some ideas and information, if you look at our website, especially about good practices, can be seen there. So I encourage you to go look at our website. A question by Caroline Brathwaite for the representative from Colombia. How do you incentivize or navigate the competing priorities with teachers in delivering the curriculum? Could you very briefly give us an answer? Yes, of course. Greetings. Well, what we have done is that in the school curriculum, what the school institution has already included, which are cross-cutting educational programs, we have already included these skills. So what we have tried to do is not create something new, but rather to include the cross-cutting pedagogical projects in the existing school curriculum. So that's the idea, that instead of adding more to the work that they already do, we simply contribute to making it richer. And the goal is that 5 years from now, we can develop even more cross-cutting educational programs to promote a healthy lifestyle, promote environmental health, sexual and reproductive health. So that's the idea. This is a first step to get involved in school curriculums. We have specific strategies that we identify with schools, and that's how we have managed to stay aligned and contribute. We also give tips for school teachers so that they know how to implement active breaks. Also, lunch breaks are also, there are a series of activities that are encouraged in order to promote physical activity. The school cafeterias as well, we're trying to encourage the sale of healthy food as opposed to highly processed food. Okay, so the idea is not to add pressure or an additional responsibility to what school teachers have, but rather to support them. And there is a question for the representative from Chile. Nidia Amador is saying that in her country, this seems risky because of a lack of security. So that makes it very restrictive to promote mobility outside of using cars in certain areas. Was this a problem in Chile? And if so, how was it addressed? Well, I do believe that this is a problem all across the region, perhaps even globally. And the truth is that drivers are also overly stimulated, and the road infrastructure doesn't always help, which means that road safety is also risky for pedestrians, for uh, people who cycle. So, what we did was, together with schools and local governments, we tried to analyze the statistics on accidents and road accidents, and we tried to identify the safest route for children. Another aspect that we considered was, and that was very helpful, was to have two what we called monitors. So, two grown-ups, one that led the group and one that came after the group, who gave them instructions on how and when to cross the roads, how to stay safe. And children also had a vest, highly reflecting clothes. They also have a sign that they can open when they're crossing the street so that cars wait for all of the children to cross, and they crossed as a group. So, above all, it's about giving visibility and raising awareness by promoting social communication, even using social media outlets to show how these ideas can be implemented with the local communities. Of course, it's not easy because we have to be addressing a series of different concerns, but I do have to say that this is not a challenge that is impossible to overcome. It is not impossible to implement this project, is what I mean. Yes, this is something to consider in the way that we implement the project, but there are many ways to work around it. Thank you. In fact, many participants did ask about the impact on the social perception of safety and security and how that can be addressed. There is another question by Ms. Martinez for the representative from Argentina about the impact on school coverage. Sorry, could you repeat the question? Yes, what was the level of coverage of the initiative? Well, the coverage, what I mean is the number of schools. Oh, okay, in schools. Very well. Well, within the program, we have three main pillars. One of them is to work with schools on prevention. So, preventing tobacco use. And if it is identified that children and adolescents are already either smoking or vaping, then we gave workshops. We had very high coverage because we worked with both private schools and public schools from the capital city, but also from other cities in the province. And we worked with schools themselves to make students themselves promoters of this project. Every year, especially in the last 3 years of school, we try to identify and select three students who then go to other schools outside of their own. And one of the innovative approaches has been that, I don't know, maybe through singing rap songs or making TikTok videos or other forms of digital advertising, because they're very tech savvy and they use social media outlets, so they themselves can use their own social media in order to share these ideas, and they find it useful and they're also more involved. So it's a good way to establish that communication amongst peers. So besides having schools that have been identified to promote public health, they also promote healthy lifestyle and environmental protection. For instance, we have one school, and this is a public school, that has a recycling program. They recycle, for instance, I don't know, leftovers from cigarette butts, and they work with a local Argentinian organization that recycles them with fungi, native fungi from Ticuman, and working together with a group of fungi biologists, these cigarette butts that would normally take 25 years to biodegrade, with the intervention of these fungi, it takes only 20 days. I mean, this is still an investigation. It's a project that is ongoing, but it's extremely interesting. And this school is one of the main champions of this program, and they also have a recycling program. Thank you very much, Dr. Ariela. It's amazing to see how when we learn about good practices, we can also get into all of the complexities associated to implementation, all of the specific challenges. And unfortunately, we are running out of time. So I'm sorry that we cannot answer more questions in this session. But above all, I would like to say thank you to our 5 presenters for your wonderful work in implementing these good practices. And from the Pan American Health Organization, we really want to encourage you to continue your work. And perhaps this is a good opportunity to interact, to get to know colleagues from other countries, and also understand how concerns are often shared, how we can motivate people to get involved in these projects, or how can we deal with security concerns, or how can we use digital tools, how can we encourage people to go to certain places in person, so how to have an intersectoral approach, for instance, to all of these programs, because all of these projects have shown the importance of working with municipal governments, ministries of health, ministries of sports, healthcare professionals, academic institutions, and all of this leads us to the success of these programs. So on behalf of the Department of Non-Communicable Diseases and Mental Health, I would simply like to say thank you to everyone who participated in this first webinar. Thank you also to Dr. Silvana Luciani, who led this whole process, who consolidated the ideas together with her team. They are members of our department, and of course, other colleagues who have supported implementation, everyone working in the communications team, in administration and management, because without them, none of this would be possible. I would once again like to invite you to visit the PAHO website, where all of the information about these good practices is shared. Very well, thank you, and until next time.